Hello, everyone. Dan Cain, VP of Clinical Services here at JAG Physical Therapy. Today, in collaboration with the National Wrestling Coaches Association, I have two legendary guests, the Santamaria brothers, Dave and Mike, two legends in the physical therapy space, but two legends in the wrestling space here in New Jersey. But we are going to talk today on injury prevention in the wrestlers, what coaches can do to prevent injuries, and also if they do suffer an injury, unfortunately, what do you do? So fellas, first and foremost, thanks for joining me today. A quick, easy one to start, a quick, easy question. You know, as I said, I mean, accomplishments upon accomplishments. What would you say if you were to look back at your 13 to 18-year-old wrestler self? What would you have done different to prevent the injuries that you've come across in your career? Dave, if you want to take it first.
Yeah, I think one thing that I would really concentrate on, which I think I overlooked when I was, wrestling in high school and wrestling in college, is just to have a better mobility practice. And the way to go about that is 5, 10, maybe 15 minutes after practice. I know everybody's like such a rush to get home, or they have to study, or to get out of the room and get on to the next thing. But just 10 or 15 minutes after practice to work through mobility. And when you're 13, 14, 15 years old, I think naturally you're kind of bendy anyway, so you can kind of overlook it, but that'll prevent injury at the time. It'll lend itself to better wrestling, to be able to get you out of positions and defend shots and kind of be a little bit more fluid when you're on the mat. So I wish I had spent a little bit more time after practice doing some stretching and just really focusing on mobility so that I could move really well, making sure all my joints had really good range of motion. And, that could set you up for even better movement later in high school and college, and then beyond that, keeping yourself healthy.
Yeah, I agree. I think when I look back at my career, my hip mobility, right? I had some external rotation, internal rotation deficits, and just even on the reverse moves, right? From bottom and just even defending a single leg, or, if you're up, you're only stable on one leg, the mobility of the hip is key. Mike, what would you say?
Yeah, good question. I think I would really dial into recovery from my end. I think at that age, and most athletes at that age, they're just full steam ahead, gung-ho. They're pumped up. They feel good. They've got little injuries that may come up. They just choose to ignore them for whatever reason. They don't want it to be a distraction. They don't want to lose their starting spot. But I would just pay attention to them more and just focus on recovery and all the little things. Taking care of sleep. At that age, it's not always a priority. So taking care of sleep, staying on top of nutrition, staying on top of hydration, and realizing the gift that our body is to us, and it's our vehicle for athletic performance, and really just taking excellent care of it.
Yeah, I think, between our 60 years of experience here as physical therapists, that's the one thing that I think wrestlers, then correct me if you guys think I'm wrong with this, we're thick-headed. Right? We want to get back. We salivate to get back, right? We're on the sidelines and maybe on the bike recovering, and you see all your teammates out there going at it, grappling. And I personally went through that when I was on the bike, and I was like, man, I just want to get back out there. But it will help you so much. And, sprains and strains, right? Especially strains, they'll just keep acting up, right? That hamstring strain will just keep acting up if you don't treat it the right way with the rest and recovery and doing the right physical therapy.
Yeah, I think a lot of wrestlers, their mentality is 100% all the time, pedal to the floor, and don't realize that a planned recovery day or calculated recovery day is going to be more beneficial than just keeping it to the floor. It's not a sign of weakness. It's more like a sign of intelligence to just step back for a day, rest, let a little bit of inflammation calm down in your body. And the subsequent days after that, you're going to feel better, and you're going to be able to get more out of those practices and those workouts than you would if you had just kind of steamrolled through that week. Just one day here and there, planned and calculated, is going to go really a long way for your overall performance and how you feel in general.
Yeah, and I think staying on recovery into a little nutrition and hydration, right? Let's switch gears a little bit. And this I think happens more, when I think coaches are aware at the high school level, but for us all, you weigh in, right? And maybe you're trying to get to certain weights, cutting weight, that meal after weigh-ins, right? And then you're trying to get back to your weight. So I think just the right meal after weigh-ins too, and not, and the right hydration, doing the right things after weigh-ins is key. And at the high school level, I see sometimes kids not eating the proper stuff after weigh-ins, and they eat too much, or they eat not the right things. Do you want to speak on any of that? Like any?
Well, I think we've all made that mistake before, where we're hungry, we just want to get anything in front of us. But I think the key is to have a plan in place. Okay, so depending on how much weight you're cutting, depending on when you're wrestling after the weigh-in, I always like to make hydration first.
Yes.
So let's hydrate, and then depending when your match is, how much time you have to digest, how big the meal's going to be, and the macros of the meal. You want to be all planned out. Shouldn't be making last-second decisions. This should all be mapped out. Get the coach involved. Get your medical team, your physical therapist, whoever, mom and dad, get them all involved on making this decision so it's all mapped out. And don't try things on match day. These are things you should have tried already. You know what foods are right for you and the timing of the foods, so you're performing at your best.
Yeah.
No, I agree. My dad, we came up with it. I made mistakes, right, in my early years, but then junior, senior year, it became a tradition. But it was, now looking at it, I was lucky my dad was a health and phys ed teacher, but I had tuna fish sandwich, I had my
banana, I had my Nature Valley, granola bars, and the water, right? 2 things of water with. So I think that it's important to have your parents, your coaches, your physical therapist, and the whole team behind you on, what you're gonna do after weigh-ins.
Dave, do you have any?
Yeah, I mean, I agree with Mike. I think having a plan is probably the most important part, because when things are kind of left to be decided in the moment, you either don't make the best decision or make kind of a hasty decision. And you can, especially as you progress and advance in your career and then the season goes on, like by the end of the season, this should be an absolute science of what you're eating, how much fluid you're intaking, how much protein, how much carbs, and it should be based on the timing of the competition that's coming up. These are not things that we need to guess at anymore.
Yeah.
It's not like when I was in high school, it's like, oh, let's have a bagel with cream cheese and 5 mini Entenmann's cookies.
Those chewy cookies, they're still pretty good, but it's at the right time,
Yeah,
right?
and then you go out there and you're like, if you feel like sluggish, you're like, oh, I cut too much weight. Well, you kind of didn't really do a good job of providing good nutrition to your body either. So
Exactly.
it's a combination of things. So I think planning it out, having it down to a science, experimenting in practice and not on match days, or maybe if you don't have as tough an opponent, you can experiment a little bit on those days. But by the end of the season, the districts, regions, states, it should be a science. Like, you should know exactly what you should be doing and how you're going to feel in response to what you're putting in your body.
Yeah, it's a good point, because you know your opponent, you know how you're fueled for it, and that's a recipe for success in my book. Nationally, actually in all sports, right? Concussions. We hear a lot about concussions. We treat the return to play concussion protocol. We treat post-concussion syndrome in patients. But, tell me, what are some important things for a coach to know about concussions? Because there's a lot of myths out there. And, this part of what I want to talk about is, let's bust those myths and make sure that the coaches understand what is true and what's not.
Yeah, I think the first thing that jumps out to me is you don't have to be knocked out to have a concussion. A lot of coaches say, oh, you have a concussion, you weren't knocked out.
Yeah.
It doesn't have to be. He doesn't even have to be hit in the head. He can be jolted in a variety of ways that could cause some trauma to the brain.
Yeah.
So that's certainly one thing. The symptoms may not be immediate. They could be later that day. It could be next week. It could be a few days later. I think it's important for the coach and the staff to have a good relationship with the athlete, because a lot of times the athlete will hide the symptoms.
Very true. Yeah.
Because they don't want to appear weak. They may not want to lose their spot. So those are the first things that really jump out to me.
Yeah, wrestlers, like we'll say throughout this talk, we're a different breed, we just want to compete, right? But the key of a coach, a parent, and any of their healthcare providers, right, is making sure they're safe to return, right? So analyzing the quick evaluations of signs and symptoms, and what are, as legendary physical therapists and wrestlers, what are some of the signs and symptoms that coaches can see with concussion?
I mean, I think some of the obvious ones is the athlete dizzy? Are they unstable? Are they disoriented? Are they nauseous? I think those are kind of the first indicators. Any of those things, you kind of know what direction you need to go in from there.
Yeah, and Dave, what you agree with those ones?
Yeah,
obviously,
absolutely.
but
I mean,
Any other?
yeah, any kind of headache or even like a neck pain kind of thing can indicate like maybe there's like a whiplash kind of thing that can lead to some speed to the impact of the brain on the skull, which can cause a concussion, right? It's a brain injury. So
yeah,
I think you need to be conscious of that. Things that I think the coaches need to be really aware of is in the recovery from a concussion, they really need to stick to the protocol. Protocols are established. They're there for a reason. It's to keep the kids and the athletes safe, because these are really potentially dangerous injuries. And this is something that I think you want to kind of err on the side of caution when you're rehabbing and coming back from a concussion. And I know that there's pressure, like you want good performance, you want to get guys back in the lineup, and wrestlers are really quick to like say they're fine and get back in the lineup and get back on the mat. But, stick to the protocols, have a good relationship with your athletes so that they trust you and that they're going to trust that you're going to do the best thing for them, and, advance them through the protocol appropriately and let the experts in that area take care of it and get your athletes back on the mat when they're supposed to be back on the mat and not too early.
yeah, and working with the athletic trainers, the physical therapists on the return to play protocol, right? That is back in the day, it was like, oh, you have a concussion. The other myth was just rest, put the lights off and just rest. That's not great. Your brain needs to rehab as well. So there are, return to play protocols where you elevate someone's heart rate and make sure they don't have those signs and symptoms while they're going through that return to play protocol, right? And that's when they don't have signs and symptoms of what Mike and Dave both said. As they're going through, they do the aerobic, right? First, you're on the bike, and as long as they're not having, they progress to the next day, which is resistance training and cardio and so on, and then to sport specifics, right? Doing actually a practice without it, So I think that's where the coach, the parents, the athlete themselves have to be real with themselves, and really, your brain is so important in life, as we all know. Missing that one match, missing those few matches is not worth it, So really take that serious. And, here at JAG, we do a great return to play protocol. And I know, it's benefited a lot of our athletes. So, recognizing and responding to those head injuries, right? And not even just the head injuries. What can a coach do when, say they get slammed down to the mat and it's they land on the shoulder, right? And the athlete, the wrestler comes over and is like, oh, coach, it really hurts. What are some quick things that a coach should be looking for, and honestly, because as we know, the main thing a coach should be doing is keeping their athletes safe, right? So what's some quick, helpful hints that coach can do?
I mean, first of all, just visually assess the area, right? If his shoulders up is supposed to be here and it's down here,
it's either here or there.
Obviously something wrong, right? Is there any kind of like visible acute swelling or edema going on in that area? So just like visually take a look at the area, ask the athlete if there's any radiating symptoms, like any pins and needles in your hand or fingers or anything like that. Those are, I think, just really good areas to assess right away without actually having to move or put your hands on the athlete first.
Yeah, I think that kind of covers it. Hopefully there's a stop in the action so you can do an assessment. And from coaches, assuming there's not medical training there, he knows that athlete hopefully very well. Body language, what kind of feedback he's getting from visible deformities, like Dave was saying with the shoulder or whatever the body part is, observing their body language. And then if you need to, you have to get the medical team in, whether it's the athletic trainer on site, PT, doc, whoever's there, to kind of screen the next level.
And I think, if the athlete, is coming over to the coach and saying, I mean, obviously the coach, the parents, the stands might have been, it's that palpable noise, right? Because you see someone potentially getting hurt. I think the first thing is the athlete's coming over to the coach saying, Coach, it hurts. I would just also, as a coach, say, all right, scale it. We know it's not the medical professional, but just so you have right then and there, simple 0 to 10. 0's no pain. 10's like I have to go to the hospital. What are you feeling, Johnny? And if they're saying anything, obviously, you don't want to put them back. But if he or she is telling you that, they are hurt. So listen, and take it seriously. Say what's the scale range. And then honestly, anything 4 or 5, it's probably a 6 to 7 or 8, because we just talked about the wrestler's mentality, right? So you gotta take that
and
seriously.
in the moment too, adrenaline's pumping. They may not be feeling everything and processing everything at that time.
Yeah.
Crowds around them.
So what are some really red flags in that moment, right? When that kid's coming over saying I'm hurt, and then they say, for example, they land on their shoulder, maybe there was a little bit of a neck, Coach, I got tinglies down my arm, give me some, we'll go through the whole body here, but give me some things that the coach should be worried about right away,
I mean, I think just doing a visual inspection, knowing your athlete, what they look like under normal circumstances, simple questions. If you hurt the shoulder, say, can you lift your arm up? Let me see you lift your arm up. If all of a sudden the kid's going like this, he can't move it. That's, just look for obvious stuff.
Yeah.
We're not going for complicated stuff. We want to go with basic stuff. If it's a neck issue, is there tingling? Is there numbness? Is there muscle weakness? Is there an imbalance in movement? Is there asymmetry in movement?
Yeah.
Kind of basic physical therapy screens, but not that the coach would be expected to do that. But I think I would just kind of use common sense, really, and how they're moving, how they look, and the feel and the vibe you're getting from them.
Yeah, I agree. And Dave, what do you think?
Yeah, I mean, I think especially in the moment, you got to keep it pretty simple. The job is to just keep it safe, and a quick visual assessment, maybe a quick, can you raise your arm? Can you wiggle your fingers? Can you wiggle your toes? That kind of stuff. And then kind of let the medical professionals step in and do what they need to do to really truly assess it and make sure the athlete's safe to keep wrestling or not wrestle, whatever the decision is,
Yeah, and I think, main thing, as we all know, is numbness and tingling. That's red flag, right? So you just want to make sure that take the time and make sure the medical professional comes and assesses that. A big thing, the Santamaria bros just said, you want to check visual inspection. What does visual inspection mean too, to dive a little deeper, is swelling to the area, right? So if someone, got their knee torqued, in a takedown or whatever, because they're defending it, is there a swelling to the area right away? Is the patella or the kneecap over here when it's supposed to be here? Just like Dave and Mike were saying about the shoulder, right? So just those swelling, pain level, numbness and tingling, those are kind of red flags that you want. Or like Mike said before, inability to, coach, I can move the arm, and he's like totally hiking the shoulder, to get compensation. You guys, like we all talked, we have 60 years probably, maybe more between all of us if we combined all our practice here. A lot of years wrestling. What are the 5 most common wrestling injuries that you have personally treated, personally seen, unfortunately maybe experienced,
I'll go back and forth with you if you want. First one that jumps out to me is shoulder.
Whoever gets the most wins the award. No.
you got shoulder. Your shoulder is first on mine. Yeah, first is yeah. Because you can damage it from a variety of means. You can come down on your side with your body weight and your opponent's body weight. Then maybe you're getting an AC issue, an SC issue. You can come down on the outstretched arm like that and have issues, the most common thought is you're in on a shot, the arm is extended. Shoulder's a tricky joint, combines mobility and stability. You need both. And sometimes you get a little too mobile, you lose the stability in it, and then you can sublocks or dislocate a shoulder. So that's the first thing that jumps out for me. And it's something, if not treated right and addressed early, it can become problematic. So it's definitely something we want to stay on top of.
Yeah. Dave, what's your number?
I had neck.
Yeah.
I think, a lot of positions, you're in on a shot, you're posting on your head to kind of come around to the side. You're getting your head torqued and pulled on. If you're underneath on a shot, somebody's got a front head on you. Hopefully you're not bridging off your back too much, but it can happen. It could be.
Well, you guys never did, so I know you guys were legends, so you didn't.
But yeah, I mean, I think neck is, or like if you're in on a shot and somebody sprawls and kind of jams your neck out to the side, it's pretty forceful. There's a lot of weight and force coming down on your neck. So I think that's number 2 on the list. What do you think?
Yeah, I think neck as well. The head and neck are weapons in wrestling. You're shooting on me. I'm going to get my head in there. I'm going to down block on you.
Yeah.
So, and it's leading the way on most of your attacks. So
Yeah.
Definitely.
Yeah, so even if you make, it's funny, well, not funny at the time, but when you're going in and maybe your head or your forehead makes contact with your opponent's body part, like you need that neck to be stable, because if it goes back or it goes this way or other, you could lose that takedown, or vice versa, right? So, one of the things, and what's your take on this, guys, is, I see we have excellent technology this day and age. Shout out to Next Level. Next Level is a great neck strengthening device. Mike and I have both used it, but people a lot just do extension, right? They're strengthening a lot, just the extensors of the neck. I personally feel like sometimes they're forgetting the scapular stabilizers, right? It's all one chain. Just give me your thoughts on that, because I see a lot of wrestling videos out there right now where they're just doing, maybe chin tucks, or they're just doing certain things. What do you guys
You
feel?
can't just focus on cervical extensor strengthening. You get pulled, pushed, rotated every direction. So you don't see people just doing back bridges. They're doing front bridges. They're doing side bridges. In a match, you're getting pulled on this way, pushed, all different direction. So I think you want strength symmetrically all around the neck for greatest stability.
Well, I mean, the neck is just like any other body part. I mean, you've got, the skeletal system in there and the muscle system in there. You've got joints and you've got muscles and tendons and fascia, ligaments, and you should strengthen it and make sure it's strong and mobile in all directions. It's not just one, plane of movement. It moves in a lot of directions. And honestly, I think it gets overlooked a little bit too much. And I get it. It's your neck. It's a very vulnerable and important area of your body, but it's just like a shoulder. It's got, joints and muscles, and we need to optimize those joints and muscles and make it as strong and mobile as possible.
All right, so we got 2. We have 3 more. What do you?
I'll combine a couple. I'll put knee and ankle in there. So the knee, I think of, especially in today's day and age, on the feet, people get in on shots. It goes right into a scrambling situation. People going over the top, grabbing their ankles, and then there's a lot of torque placed on the knees. And the refs do a great job of calling potentially dangerous.
Very true,
even gets to that point. So kudos to them. But a lot of times, knee injuries can happen from just getting in those scrambling positions, which are so common these days.
And I think kind of a smaller joint, but I think a really common injury or area that gets injured is like the fingers in wrestling,
That's what I had my last one.
Right. Yeah. I mean, middle. You get in a shot, especially in practice when the clothing's like a little bit looser and a finger gets in there and somebody's pinky is like sideways, you can get one of those quick relocate jobs on it. So, I mean, I think having good grip strength and making sure you're getting range of motion and managing the symptoms in there, some ice after practice, and, buddy taping it to the next fingers, I think that's one joint where you could push it a little bit and just kind of suck it up in that area,
There's a reason why the practice shorts don't have pockets. It's just another place to get a finger. I'm caught.
Yeah,
that's very
And the
true.
clothing not being too baggy, but as you sweat, it starts getting a little bit looser.
And then think about, like, hand control situations, right? What's the first thing you try and go for the wrist, or but sometimes you're peeling off fingers if you're standing up, right? So that's, the bending back, or just, everybody has that dirty wrestler out there too that might go for the fingers, and use it to his or her advantage too, right?
Definitely
So
impact your wrestling ability if you can't have full grip or your normal strength level on your grip. Absolutely.
Yeah, so just definitely we have some exercises you could do for that, but just even squeezing a ball, checking your handheld. There's a handheld dynamometer, right, where you can check your grip strain, but like the fella said, it's underestimated, right?
That's opposite. You ever seen the reels on that one where they go around, they measure?
Yeah.
That's a real popular one.
It is. I saw. Shout out to Princeton. I saw the Princeton wrestling team did that. So yeah.
I like to educate the athletes. This part of the grip strength coming from the intrinsic muscles, the muscles in the hand, but also in the forearm as well.
Yeah.
So that's something as physical therapists we can train athletes in.
So it's all connected, right? From the shoulder stability and then all the way down. That's the biggest thing I think. What we do here at JAG is it's the whole body. You got to strengthen, like when we get into like core. Everybody thinks your core is just, six-pack abs. No, it's everything from here down to your knees, right? Just like we just talked about the neck. It's everything. Yes, you have your neck stabilizer, your neck strength muscles, but it's down. Your back is your scapular stabilize your neck, help stabilize that too. So whatever joint above and below, you need to strengthen, right?
Absolutely.
So, when I reflect on wrestling, like you guys are physically brothers, right? But think about all the brothers and all the coaches that have had, like, there's something special about wrestling in terms of the bonds you make, right? So I think, what have some, like, coaches for you, like the impact coaches have had on your life? Like, and, whether it's words of wisdoms or fond memories that, because a coach is so powerful, man. Like, it's just amazing what they've done. And I put wrestling coaches above anyone as some of the best coaches out there because they're dealing with so much. But yeah,
I mean, the coaches wear a lot of hats. Obviously, they're your coach, they're your psychologist, they're your dad at times. They just wear a lot of hats there. I mean, my favorite coach story is Mike Moyer. He was my head coach at George Mason University. Currently, is the executive director for the National Wrestling Coaches Association. Does tremendous work for the sport of wrestling. Unbelievable work. Maybe a month before I was graduating college, I have a psychology degree. Coach asked me, Mike, what are you doing after graduation? I said, Coach, I'm not really sure. He goes, I think you'd make a great physical therapist. And my response was, Coach, what's a physical therapist? I've never heard of it. I don't even know what it is. He gave me a little explanation to it. And so sure enough, after I graduated, I went home and I looked up some job opportunities as an aide in a local clinic. And that was my first exposure to physical therapy. Fell in love with it. So to this day, I stay in touch with him, see him, speak with him on the regular. And I always remind him, I thank him for pointing me in that direction. So what a great thing a coach can do, can guide a student, athlete that not really sure what direction they're going in life. I mean, I owe that to him.
Yeah. And I know, thank you, Coach, because we're lucky that I'm lucky to have him as a colleague. The patients are lucky to have him as a therapist. Like I said, and I stand by this. He's a great leader. He runs Monmouth County for us. He gives back so much to his patients and cares about them so much. So I've had the opportunity, right? I know how much Coach means to Mike because you've introduced me, right, to him. We're at all the wrestling functions we go to as a team, and so thanks, Coach. But that's awesome. Dave, what would you actually? And Dave, sorry to cut you off, but is an active coach too. He's coached at CBA for years, giving back not only as a physical therapist, but still coaching the youth, so.
Shout out to CBA, number 9 in the country.
Yep.
Yeah.
Christian Brothers Academy, number 9 in the country. And honestly, they were lucky to have the Santamaria brothers too go through that.
I mean, I've been extremely fortunate for the coaches that I've had. I think my high school coach was a great coach. I still talk to him to this day. And I think kind of a funny story has nothing to do with wrestling. I was talking to him 2 years ago when we were talking about hunting and wrestling and family, and I was dead set on having 2 kids. Nothing was going to change my mind. And, you know, I asked him about his kids who I know and I'm friends with because they're my age. And he said, you know, it's great to have them home for the holidays, but I wish I had had more because it'd be, you know, just like more love and more enjoyment and more fun. And whatever he said in that moment, like, kind of struck me and changed my mind. And now my wife and I are having our 3rd kid in the spring. So, you know, between him and this other coach that I had growing up, Ernie Monaco, he's like the godfather of club wrestling in America.
Edge wrestling.
Yeah. So, I mean, just, you know, all the things that I do as a coach and a lot of things I do as a physical therapist, which in a way you're kind of a coach for that person, is almost just like duplicating what Ernie said to me or the way Ernie acted. And I just like try to implement and execute on what he did because he was so successful and so like impactful for me.
Interesting, like his 2 stories, my 1 story, none of them had to do with wrestling.
Yes.
Yeah, it's pretty cool that the coaches can impact people like that.
Yeah, for sure.
I have some similar stories too. Like few of my coaches, I had my senior year, I had this tough loss that, you know, I thought it was, you know, gonna end my whole progression of my season and me from winning the conference and winning this and stuff. And one of my coaches came up and I was fuming after it, and they let me cool off. And he came up and I was like, oh, this is, you know, I might have used some explicitives and stuff. And he's like, Dan, come to the office. And he goes, you're better than that. You're a better person. You're a better human. This is not gonna end your run. And he's like, I respect you. Coach Blakely, West Milford High School, he didn't have a son. He's like, you are such a great kid. You're such a great person. You would be the son that I would want. And you are my son, he said. So that really struck me, changed my whole perspective. And then one of my other coaches, Coach Citro and Coach Vetter, both wrestled in college as well, but they were West Milford coaches. Vetter came up to me before districts, and he goes, hey, come in at 8 o'clock. He's like, I know weigh-ins aren't until whatever, but he's like, I've been studying this kid that you're going to wrestle, and I want to show you all his moves and what, you know, you need to watch out for. Well, it worked. I won that districts that night, and I'll never forget that, you know. Geez, it's like, you know, and then going into just life, unfortunately, I lost my dad, and all those coaches were always there. You know,
through that.
From day one. So.
That's nice they had your back.
Yeah.
Part of the team, part of that fraternity.
So it's bigger than, as we all have the different stories, it's bigger than just wrestling on the mat.
Yeah.
So, thank you, all the coaches out there. So, as we said, a coach is so powerful in so many ways there. You know, I look back at all those coaches, too, that we all just talked about, and I give wrestling coaches, like, they were doing stuff that, right, dynamic warm-ups, right? They're so important. Now, when we talk a lot about dynamic stretching, dynamic warm-ups, we were doing that. I mean, I'm 20 years out of high school now, and we were doing that in high school, you know? So tell me about a dynamic warm-up and kind of, like for me, you know, we would obviously jog around to just loosen up. Then we were doing bear crawls. Then we were doing, like we talked earlier, cartwheels. We were doing crab walks. Like, all that is kind of dynamic warm-ups that sets the tone. So tell me, like, when you reflect back on that.
It's the exact thing that it describes. You're warming up your body. You're preparing your body for action. I mean, the sport of wrestling is incredibly physical and intense. So if you're doing fun warm-ups, you're going to get greater compliance. So obviously you can do some light jogging around the room. That's fine. Let's do a forward roll. Let's roll to the right shoulder. Let's roll to the left shoulder. Let's do a cartwheel. Let's do a round off. Let's do a back handspring. Let's do a forward handspring. Like, let's go round off to a back tuck.
Yeah.
It's great for body control, which is very important in wrestling. let's play a game. How many times you play dodgeball?
Yeah.
I mean, dodgeball's great.
Handball, right? Dodgeball.
What's
handball.
everybody doing in dodgeball? They're moving a variety of directions. They're bending, they're twisting, they're throwing, they're breathing, they're smiling. It's fun. So, I mean, that kind of accomplishes it. I think get the music going in the room, just try to up the energy level. So I think it's great.
You're doing, like, during that dynamic warm-up, you're doing things that you might encounter in a match, right? So you're, while dynamically warming up the muscles, but also kind of stretching, right? A prolonged single or prolonged double shot, right? And really getting the hip flexors stretching while doing that double and stuff like that. So
Yeah, I mean, cartwheels, head springs, handsprings. You walk into a wrestling room today, and it almost looks like the beginning of a gymnastics practice.
yeah,
But it creates body awareness, it creates strength, it creates some explosive strength. You're doing plyometrics, upper body plyos, lower body plyos, creates stability, helps you create or build those fast twitch muscles, those reactive muscles that you need to respond and react to while you're in a wrestling match. And like, you can walk into a room and watch that warm up, and you can almost know who the best wrestlers are by those warm ups.
yeah, because it's the coordination, right?
Coordination,
Yeah,
who's the most athletic, who's got the best body.
flexibility, right? It's
Yeah.
a lot of, yep.
All those components combined can.
The one thing that, I remember too is it's like cardiovascular endurance is huge, right? If you do not want to burn out, you do not want to lose in overtime, right? That was always the saying, we're too conditioned, we're too trained to lose in overtime. One of the things that I think my coaches back in the day helped with was we would do strength training type of stuff, but endurance wise too, right? So what am I talking about? I'm alluding to supersets, right? Of 15, 10, 5, 1, or sometimes we started at 25, but 20. But like, I'm talking about V-ups, I'm talking about, squat jumps, stars, whatever you want to call them, push-ups, and you would do them, those calisthenics, that built, like, obviously all the running and stuff we did too, or stairs, but that really just built endurance. Like, did you guys have
You're talking about like some cardiovascular endurance, which is heart and lungs, but then you're also talking about like localized muscle endurance too, right? So,
yeah.
Your heart and lungs are going to supply everything, and that's the foundation. But if your quads specifically are going to get tired, you're going to come out of your stance, right?
Sure.
If your forearms get tired, like that grip when you're trying to hold somebody down in overtime, that's going to go, and you're going to have a harder time holding somebody down. So, yeah, I mean, those things help build that foundational endurance, but also that like localized muscle endurance that's going to keep you in your position and keep you in your stance and help you finish that shot, later in the match and help you win.
I agree. And so when I reflect back, that's exactly what I was getting at. I think those were the exercises drills that we did that made me better, and I'm lucky to say I never lost in overtime. So
Yeah, I think a lot of the coaches and a lot of the science these days shows how some heart rate awareness, staying in a zone 2 or a zone 3, if you do a lot of training there, it's at a lower intensity. So like Dave said earlier, you don't always have to be going 100% and banging all the time. You bring it down a notch, you open things up offensively. And you're in that zone 2, zone 3, so you're getting some aerobic benefit, and hopefully your technique is sharp, and you can build your aerobic machine that way and decrease the likelihood of injury too.
yeah,
And hopefully open things up offensively.
it was a game changer. So I think taking that together, you also want to watch how like Dave said earlier, like, don't do that every day, right? You got to mix it into practices. I think one of the great things that wrestling coaches know is that, right? They know that they got to change up practices each day to hit different, muscle groups. And what I'm alluding to is how overtraining, right, certain muscle groups or returning too early can be devastating too. So, I want both of your analysis on what you would do to clear someone to return to the mat. You can talk about any injury, just some things that we should be looking for as coaches and as therapists, but also what kind of would overtraining a wrestler look like to you? Like how does that happen?
Now, these days, like we have so much technology at our hands that we can just get hard data to indicate overtraining. You know, we can look at numbers like resting heart rate, HRV, sleep score, recovery score. So we almost don't even need to guess when somebody's overtraining. We can get
Like that, you know, whether it's your watch or
yeah,
whatever.
just like a wearable is going to give us a lot of information.
Yeah,
but
sure.
subjectively getting a report from, you know, your athlete just to see how they feel. Another thing that you can do to actually indicate where they're at performance-wise physically is check grip strength. If your grip strength is not consistent on a day-to-day basis, like if it drops like 10 points or something like that, you need a rest day. So, you know, your coach could even do something like, you know, the dynamometers at the door when you walk in, let's check your grip strength, you know? You should have baselines from the beginning of the season as the season goes on, and you can know like, all right, do you need a rest day or you just need to be at 75% that day? Like you need to get a workout, but you don't need to push it. You need to give yourself some recovery. So that's a really good objective measure. And then subjectively, you know, they feeling tired, if their energy's low, if, you know, they're like a little cloudy or they're not
Sleep
sharp,
score, right?
Sleep score, of course, you know? So, I mean, there's a lot of data we can look at that can indicate, you know, if they're overtrained, if they need some rest, if they need some recovery. You know, it's subjective and objective stuff, especially combine that, and there should be no guesswork as to where somebody's overtrained.
I mean, that's perfect. Combining the science and the art. I love the science. I love the sleep data. I like the sleep scores. I like the HRV. But having that relationship with the athlete, if they're dragging, if their attitude is kind of down in the dumps, or you can look at both.
Yeah.
You put them both together.
The psychosocial perspective.
And if it's too
right?
early, you're going to compromise the athlete. Okay? It's going to be a higher percentage of reoccurrence if they go back too early. So it's a proper ramp up to get them back in.
Or the injury could even get worse than it originally was, right? And go like way backwards, right? Or you get a tear, or you like ligament tear or something.
I mean, us as physical therapists, we regularly give our opinion on when they're ready to get back on the field or get back out there on the mat or whatever sport they're playing. So if it's a shoulder injury, I want to see a certain percent within a symmetry between the two, or if it's knee or if it's ankle. It will put you through a series of tests. It will do unilateral testing. We'll compare the uninvolved side to the involved side. If you're not within a certain percent, that tells me you're not ready. If you're on the mat and you're thinking about your injury, that tells me you're not thinking about wrestling and you're going to be distracted from executing.
Yeah. And I think it's challenging, like you said, we put them through functional tests at JAG here where you didn't challenge every plane, but it's wrestling specific, it's sports specific. I think, you know, that's where everybody needs to, wherever they're getting rehab, they have to put them through stuff that will happen during the match, right? And challenge that shoulder when you're, you know, posting up or whatever, and make sure that they have no pain with that. I think the other key is the interdisciplinary family, I like to call it, or the interdisciplinary care family. So, you know, they might be seeing Mike or Dave or I in the clinic, right? We have that connection with their parents. We have that connection with their coach. We have that connection with their athletic trainer, right? And all of us, because that's what's best for the athlete, right? Is if everybody's communication is key, and that's sometimes what's missing, and the MD, right? If it's a doctor involved. And I think that's what everybody should be doing. But one of the things I could hang our hat on, right, that we do here, but that's what's the best interest of the athlete. And I think coaches being aware of that and everybody really embracing that is key wherever you are in the country.
So you're ultimately describing a culture, and that's a culture that JAG has. And for me, it's a privilege to be able to treat you. And it's a privilege that you trust me enough to share what's going on with you. And you can tell me what hurts, what's getting better, what's getting worse, and share that information with me. With a wrestler, 99.9% stop wrestling at 22. God willing, they're going to live another 70 plus years. So we've got to plan in the big picture as well, not just that match on Saturday.
You hit something that just sprung up in my head. You know, what has wrestling influenced you just in life skills, right? It's something like we said, it's bigger than the mat. You just said sometimes wrestlers stop at 22, right? What has it done for you as people? just in your everyday life? Like, what skills do you now still use?
I mean, I think the biggest thing wrestling does, and this is like a little bit cliche, but it creates like an ability to be comfortable being uncomfortable. You know, so I think maybe Joe Rogan said it, is wrestlers take a lot of pride in being uncomfortable and being perfectly comfortable with that. You know, that's what makes some of the best wrestlers. And I think that carries over into day-to-day life and just being able to push through uncomfortable situations so they take the next step with having a conversation with somebody, or, you know, just being able to stay in shape and push yourself through workouts as you get older, or just being able to stay healthy for your kids and your family, and just, you know, being able to take yourself to the next level and push a little bit more and just be okay being uncomfortable.
I agree, and I think that's why wrestling is such an important sport for so many reasons, like life reasons. But Mike, what?
Yeah, so whenever I get a resume across my desk, I love seeing that they were a wrestler, because right away for me, and I like to think for those that at least got to a decent level or competed at a high level even, discipline. That's the first thing that jumps out. And hand in hand is work ethic. I think my attitude is no one's going to outwork me. You may be better than me or have more skill in some things, but I'm going to keep working until I catch you. So I think that carries over into all components of life.
Yeah.
Like Dave said, whether it's your job, whether as a spouse, as a father, as a, you know, helping people, parents, whatever, family relationships, just putting the work in.
Yeah, mental strength is real from wrestling, right? We've all gone through it and experienced it. I think also confidence, right? Builds confidence in how you hold yourself as a person. You think about it. You're one-on-one out there with your opponent. It's just you two. It's a team sport. We all know that, but you have to have the confidence and the mental strength in yourself. And I think it goes back to, I'm going to outwork anyone. I'm going to outwork this guy or gal on the mat. So I think that's what it builds. And I think we hit a lot on it, but that is why, in my eyes, the psychosocial component of managing a wrestler is so important, right? From when they get injured, but even if they're not injured, as coaches, they rely on you for that mental strength at times too, right? The wrestler relies on their coach for that mental strength, and I think that's really important for coaches to understand too. And but you said, you all alluded to it before, you know what, Dave Santamaria, like what he looks like normally, and if he's dragging that day, what's up, Dave? Is something going on? They might even come out and say, Coach, I didn't tell you, but my knee's bothering me a little. What's going on? So get to that level too. Like if you notice something's off, talk to him about it. Don't let it go, right?
Absolutely.
The last thing that I'll leave you with is, what's the most important exercises for wrestlers to do? Like in general, you could give me one for each body part, or you can,
I have an answer. I don't know if it's the answer you're looking for. I think it's one word answer. It's balance.
Okay.
I want balance between strength, mobility, conditioning, technique. If we do that, I think our athletes are going to be well taken care of. And then it always goes back to the relationship and having the team support around it. You put all of these components together, you're going to get your best outcome. So keeping balance between all those things, not one exercise or one thing. So a ton of good things out there, but that would be my answer.
And I loved where you went with that, because I think balance in general, balance exercises, right, are important to, that's important. But balance is made up in general when we talk the PT lingo of balance, right? What makes balance? Well, your proprioceptors, your strength muscles, right? Everything comes together to allow us to have balance, and that's where your answer was perfect. Not to put you on the spot, Dave, but your answer was perfect because you combined it's a lot of stuff. And I think one thing in physical therapy in general that we miss as a whole is, all right, I want to strengthen this muscle, so we're just going to do external rotation. No, I'm going to do external rotation in the functional position of a bear crawl while having bands on the lower, train more than just the one spot, right? Think outside the box. Get functional, get specific to what the athlete, whether it's wrestling, needs to do, you know? So I think that's what any exercises that we think we need for the upper extremity, combine it in a functional position of where then they use it in the match, right? That's what, even if we're trying to help someone get upstairs, we're going to functionally train them on stairs, like at times, right?
That is a fun part about being a physical therapist, especially at JAG. They encourage creativity. It's not a cookie cutter recipe. Do this, do them in this exact manner. Get creative, get fun with it. Come up with something that's going to be useful to them. They'll remember it. They'll enjoy it. They'll get max benefit from it. They'll do it safely. So
Yeah,
I like that component.
Dave, what would you say? Now that we took all the great, I mean, those were great answers, so I don't know why you're going to...
I mean, you know, I like to incorporate like full body movements, large compound movements. I think they just help the whole body kind of work together. You know, there's not isolating it and breaking it down is, I don't think, as useful as doing a larger compound movements for your body. You know, I think when you're wrestling, you're using almost every single muscle in your
You're
body.
in every plane, right? Yeah,
So
it's like transverse, sagittal, frontal.
Yeah, I think if you can just do bigger explosive movements, like it's going to transfer over a little bit better to wrestling. Dike.
Well, fellas, it was an honor. Thank you. I appreciate you guys.
Yeah, my pleasure. It's good. It's fun.